Well, good morning and welcome to the session on Orofer XT. Well, we are going to talk about ferrous ascorbate. Well, ferrous ascorbate is a stable complex of iron and ascorbic acid. Well, ferrous ascorbate is the world's most widely recognized reference iron. Now, nearly for 4 decades, studies on iron preparations have been benchmarked against ferrous ascorbate. Properties of ferrous ascorbate are thus considered as the gold standard in iron therapy. What makes ferrous ascorbate different? Well, ferrous ascorbate is a stable complex of iron and ascorbic acid, or the ascorbate, which does not dissociate on entering the GI tract due to stable chelate of iron with ascorbate. It has no action of food inhibitors as the complex does not dissociate. There are no free radical formation. There is no oxidation to ferric forms as ascorbate maintains the iron in the ferrous form. It offers much higher absorption, and this absorption is 4 times higher than the absorption of ferrous sulfate, which is very much visible on the graph, which you can see. There are comparative iron formulations which are available, and you can see ferric ammonium citrate is offering less than 5%. Whereas carbonyl iron, they're definitely less than 10% of absorption in percentage. Ferrous sulfate is nearing 10%. Whereas ferrous ascorbate, you can see it's in around about 40%. So it offers 4 times higher absorption than ferrous sulfate. What about the free radical release? Well, this is of utmost importance because whenever the free radicals are released, well, they will be the cause of the gastric irritation. So you can see here in this figure that when the iron salts are taken in the ferrous form, there is a passive diffusion to the mucosal brush border cells of the duodenum. When there is a conversion of ferrous to ferric, a free radical is released. And this ferric bounds with the transferrin and is then transported into your blood. Now the blood, along with this, you can see there is a free radical formation when the ferrous has come out. And this ferric iron, this ferrous iron which is there, will be the cause of oxidative stress, and it can lead to many side effects. So our ferrous has least of it because of the ascorbic acid incorporation. Actually, ascorbic acid, the role of the ascorbic acid or the ascorbate is to scavenge or to eat up the free radical which is generated from the conversion of ferrous to ferric ions. So this eating away or scavenging is provided by ascorbic acid. What about the tolerability, we'd like to know? Well, studies show that ferrous ascorbate is better tolerated than other iron preparations. Higher absorption leads to lesser amount of free iron in the GI tract, causing less GI irritation. So there are a few major trials which have been done on this ferrous ascorbate. Well, we always talk about HERS study, H-E-R-S study, that is hemoglobin rise and safety trial. Well, the objective of this trial was to assess the efficacy and tolerability of Orofer XT in treatment of anemia. Well, the dose was 1 tablet orally once daily for 45 days, and the number of doctors involved in the study were 300 across India. Total number of patients which were enrolled were 1,461. The results of this study was that there was a rapid increase in hemoglobin, mean 2.37 grams per deciliter within 45 days, and was well tolerated. The maximum increase of 3.6 grams per deciliter was observed in those with a baseline hemoglobin less than 6 grams per deciliter. Well, this was the trial which was published in the International Journal of Gynecology and Obstetrics in July-August 2005. Well, later to it, there was many studies done by Dr. M.B. Agarwal, who is a hematologist in Bombay, and we have the PRIDE study for it, where along with Orofer XT for 45 days once daily, he added one more arm to it, Orofer XT tablet twice daily for 15 days and followed by once daily tablet for 45 days. Now we have the PRIDE study. We'll talk about performance of reference iron in iron deficiency anemia. Well, the objective of this trial was to assess the efficacy and tolerability of Orofer XT in the treatment of iron deficiency anemia. 1 tablet BID for initial 15 days, followed by 1 tablet OD for the rest of the 45 days. Study was conducted by Dr. M.B. Agarwal, and the number of patients enrolled was hundreds, and the results which came out of this major study was that there was a mean rise in 1 month approximately 4.48 grams per deciliter. There was a mean rise in 2 months approximately 6 grams per deciliter. When a baseline hemoglobin 6.16 grams per deciliter. Then we have a study on the carbonyl iron, a comparative study. The objective of the study was to compare the efficacy and tolerability of ferrous ascorbate and carbonyl iron in the treatment of iron deficiency anemia. Again, the dose was 1 tablet of Orofer XT and 2 capsules of Fefolz once daily for 60 days. Study was conducted by Professor Dr. M.B. Agarwal in Mumbai. A number of patients enrolled was 60. There was a mean increase in the hemoglobin with Orofer XT tablets, approximately 5.03 grams per deciliter as compared to 2.82 grams per deciliter in the carbonyl iron group. 93.33% patients rendered non-anemic by Orofer XT as compared to 46.66% patients by carbonyl iron. Orofer XT also resulted in significantly greater increase in serum ferritin levels than the carbonyl iron. So to conclude, Orofer XT is more effective than carbonyl iron in the treatment of iron deficiency anemia. Well, these are the 3 major trials which we talk about in the doctors, and we highlight the advantages of Orofer XT tablet.